All right, thanks a lot, Rach. Well, parents, listen up. Hand, foot, and mouth disease is more common than you think, and it's more than just like the blisters that your children can break out in. They can break out in a rash, run a fever, lose their appetite. So, Dr. Harold Naiman is here with some tips on how you can prevent this viral disease. Doctor, thank you so much for being here.
Good morning. Thanks for inviting me.
Absolutely. We haven't talked about this disease, hand, foot, and mouth disease, for a while now, but it is out there. Tell everybody, first of all, what it is and what we can do to prevent it.
It's a viral disease that young infants and children can get over the summer months and early autumn. Typically it can start with fever. It can be low grade or sometimes very high. They can have general symptoms: malaise, not feeling well, lethargy, tiredness. It can start after the fever with various sores, blisters in the mouth, tongue, gums.
Painful.
Very painful, very painful. Often young ones are drooling, they don't want to swallow. After a day or two, they may break out with little red dots on the palms and the soles.
Illustrated here in these pictures, folks. I don't know if you can see your screen now, but this is hand, foot, and mouth disease, and again, it can be very painful. Go ahead, doctor.
The little red dots can turn to little blisters or bumps, and very painful. Often we need to use pain medicine like acetaminophen or ibuprofen to handle the sores in the mouth and the hands and feet. Okay,
and the places that are most prevalent with regard to hand, foot, and mouth disease, I know are schools. What are some of the other places, doctor?
Daycares, for sure. Any place where kids congregate is where this can spread. It's person-to-person spread through cough, secretions from the nose, mouth, or water from the blisters. They all carry the virus, as stool can.
Okay, so let's talk about preventative measures, because again, I know that on the list that my son got on when he was going back to school, hand sanitizer and Clorox wipes was at the top of the list.
Absolutely. Hand washing is the #1 tip to prevent transmission of this rather nasty disease. Covering yourself with a sneeze or cough in the appropriate way so you don't spread the germs through the air.
And speaking of appropriate ways, when a child coughs, they should cough not in their hand, but in the arm,
into the elbow, or
in the elbow. Okay.
Right,
all right, gotcha.
And so they don't contaminate their hands when they touch the next person or shake hands. Sanitizing doorknobs, toys that kids play with, probably with a soap solution, and with the Clorox after to kill the virus would be very helpful.
So in other words, washing your hands is something you should do all day with kids.
All the time.
All the time.
All the time.
Okay. All right, doctor, thank you. Some great information here. We hadn't heard about this disease for a while, but you work for the...
I work for Healthcare Partners. We have 3 offices. The office I work out of is Tenaya and Cheyenne.
Okay.
Near Mountain View Hospital.
Very nice. So folks, if you have any questions, of course, you can refer to Dr. Naiman. And what is it, Doc?
I brought you a little present. So this is something you might want to use after shaking my hand.
I shook his hand, so now I need the sanitizer too. All right, Rachel, this doctor is always prepared.
Yeah, just make sure to let him know that a lizard ate part of his stethoscope. So I'm not sure if he's aware. All right, guys.